Selamat pagi pemirsa Dr Yanti TV. Hari ini saya kedatangan tamu dari jauh. Beliau ini adalah Mr. Benito Novas. Beliau dari US dan beliau adalah seorang daripada founder Global Stem Cell yang berpusat di Miami, Florida. Kemudian juga saya kedatangan tamu yang kedua, Dr. Marisa Novas. Beliau adalah Director of Medicine dari US, ya kan? Kita akan di sini, saya sangat gembira sekali karena mereka akan datang untuk mentraining Dr. Yanti Klinik, menjadikan Dr. Yanti Klinik Stem Cell sebagai standar internasional training di Indonesia. Good morning, Dr. Marisa. How are you today?
I am really happy and really honored to be here with you and having the opportunity to share all this time with you, and I really appreciate that you have us here. Thank you so much.
Good morning, Mr. Benito. How are you today?
Good morning. Good morning. Thank you so much for having me here.
Mr. Benito, I ask you. Okay.
My name is Benito Novas, and I'm the founder of the Global Stem Cells Group. And I also am the managing director of the ISSCA, International Society for Stem Cell Application.
Yes. What is the purpose of the Global Stem Cell?
The Global Stem Cells Group was a company that was created around the passion for regeneration. The concept of regeneration in modern medicine has been around for a number of years, but for some reason I found that it was not widespread, or at least patients were not benefiting from the advancements of this technology. So we created this company, and its main purpose is to spread regenerative medicine technologies around the world. That's hence the name Global. So basically, it's a company that's dedicated to fully expand the field and to bridge the gap between physicians and academics and learning institutions, and in trying to, as much as possible, translate these technologies into a point of care and benefit as many patients as possible.
What is the vision of and mission of the Global Stem Cell Company?
Yeah, the Global Stem Cells Company, it's a group of company. Global is a holding company, and below it's a group of company. Each one is dedicated to certain different aspects of the field. So for instance, we're capable of equipping and furnishing and constructing laboratories, stem cell laboratories, from the most basic one to the most complex facilities. We also manufacture cellular therapy products. We have our ISSCA, and I guess we're going to talk about it a little bit more. It's our training arm. So we have different entities, and like I said, they all are unified in the same mission, and the mission is to spread regenerative medicine as a whole, as a new specialty in modern medicine that will translate in alleviating human suffering in the world.
What is the vision and mission of the ISSCA?
Yes, of course. Thank you. I mean, the ISSCA stands for International Society for Stem Cell Application. And this was an organization that was dedicated to create standards of practice. One of the problems that we have in the regenerative medicine field is the lack of unified criteria or standards of practice. So the ISSCA was created as the gold standard. I mean, we look to come up with unified ways of doing things, and that's so we can prove, so we can establish the safety and efficacy of these procedures. Not only that, there is a lack of systematic lack of education in the field. What can these therapies do? The real scope of the results that we can achieve with them. Are they safe? Are they effective? How long would it take to to assist certain conditions. Are they a cure for something? Are they not a cure? So pretty much what we try to be is a light guide. It's a guide for physicians, for scientists, for learning institutions, even for government, for regulators. So we try to foster an environment of communications, of trainings, of empowerment, so we can together advance the field of stem cells and regenerative medicine and cellular therapies.
Okay. And the last question, what is the vision and mission of the ICCCA? Please tell us.
Thank you. It's a complement of what I was saying before. The mission in a short term is to empower physicians to access a knowledge base of what's available in the regenerative medicine field today, and certification, creation of standards that will help us further the field and establish the safety and efficacy of these procedures.
And Dr. Marisa, maybe you tell for us and you introduce yourself for us. Please, Dr. Marisa.
So I am Dr. Marisa Novas. I am the Medical Director and Research and Development Director for Global Stem Cells Group and ISSCA. We have been doing trainings for physicians, and we have been treating patients for the past 12 years all over the world. And now this is our time to be here in Indonesia with Dr. Yanti. And it's a really exciting time for all of us.
What is the stem cell?
Stem cell is basically a cell that can divide and produce other cells. Stem cells are the raw materials from our bodies to create new cells. So basically, we have stem cells in all the tissues, and these stem cells are responsible for regenerating the tissue and producing anti-inflammatory effects so that the body can heal itself. So that's a general concept.
Who can use stem cell?
Well, stem cells have been in use in medicine for the past 50 years.
Okay.
The first stem cell treatment that was done in the world was the first bone marrow transplant.
Yes.
A bone marrow transplant is a stem cell treatment because basically we're regenerating the bone marrow using stem cells. So that being said, stem cell treatments are available for a number of patients and a number of diseases. And every time we do more research and we develop more protocols for the treatment of different conditions. So right now in the world there are a lot of trials going on, and our company, ISSCA and Global Stem Cells Group, have partnered with a lot of physicians all over the world to create protocols, standards and protocols of treatments for different conditions, and I believe we're going to be working with some of your patients today and tomorrow.
What is a medical proof of this method stem cell? You tell for us, please.
Well, that's related to a little bit of what I was saying before. Right now in the world are running more than 1,000 of clinical trials with stem cells. There has been a lot of publications that show in phase 1 and phase 2 clinical trials that show safety and that shows effectiveness. Now, for example, as soon as 3 months into the pandemic, they started running a clinical trial in China and in Israel and in the United States using stem cells for the treatment of the pneumonia associated with the COVID. And that is based on other clinical trials that have been done before, not only for pneumonia and COVID, but for arthritis and for chronic degenerative conditions, neurological conditions, stroke, and certain other type of diseases and conditions that you can find, like diabetes, for example, and such. So yes, there is a lot of clinical trials registered. There is a lot of medical documentation that shows effectiveness and safety on the stem cell treatments.
Thank you so much, Dr. Marisa, for your learning and your teaching for us. And then I did to stay and I talk for my audience with my language.
Absolutely. I would love to learn, but it's kind of hard.
Iya, iya. Hai pemirsa Dr. Yanti TV. Tadi kita sudah mendengarkan pemaparan dari founder dari Global Stem Cell Group, and kita juga sudah mendengarkan dari Director of Medicine, Dr. Marisa. Kita sangat senang sekali. Kenapa? Karena kita diedukasi. Mereka mengedukasi kita, mereka menstandarkan training stem cell sebagai international standar di klinik kita. Oke, sampai jumpa lagi pemirsa Dr. Yanti TV. Stay up. Oke.